The Kenyan government might not admit it, but the writing is on the wall. TikTokers have declared war, not with placards this time, but with bricks, mortar, and a 1.5 billion Kenyan shillings dream. As of this week, Kenyan Gen Z had announced plans to build an ultra-modern community-owned hospital. Free treatment, no consultation fees, no SHA deductions. And if you think this is just another hashtag movement, the numbers and the panic in official circles tell a very different story. This all started with frustration. For many years, Kenyans have been promised free healthcare, yet families still go bankrupt paying for cancer treatment, mothers die during childbirth, and emergency patients are turned away for lack of insurance. Even after the launch of the Social Health Authority, many Kenyans feel trapped in bureaucracy, red tape, and hidden costs. Gen Z, fresh off organizing historic protests in 2024 and 2025, has decided they are done waiting for politicians. They are now saying, if government can't fix healthcare, we'll build our own. The scale is not small. We are talking about a level 12 referral hospital, equivalent to a top-tier county or national facility, complete with specialized care for cancer, heart disease, maternal health, and emergency services. The initial fundraising target 1.5 billion Kenyan shillings, or about 11.6 million US dollars. It sounds insane until you look at the numbers. Kenya's TikTok community is massive, with millions of active creators and audiences that dwarf local TV stations. One viral fundraiser recently pulled in over 2 million Kenyan shillings in just days. Multiply that by the sheer energy of Gen Z and their diaspora supporters, and suddenly, this doesn't sound so far-fetched. The strategy is simple but genius. TikTokers are using live streams, challenges, donation drives, and viral campaigns. Engineers, doctors, and even plumbers have offered their skills. Diaspora Kenyans are pledging from abroad. Platforms like M-Pesa and TikTok's donation tools are becoming the backbone of the movement. Unlike political fundraisers where money disappears into smoke, this initiative is transparent and community-driven. Volunteers are already drafting blueprints, legal teams are advising on NGO registration, and conversations are happening about sustainable models to keep services free once the hospital is built.
Kenyan government is in shock after Kenyan Gen Zs on TikTok declared that they are going to build a hospital, a big hospital, which is going to cater for the poor. But why are they doing this? The healthcare in Kenya, it has become very expensive because of the recent regime. With the previous regime, it was very affordable, but the recent regime, they have abolished everything which was from the previous regime, which was making the healthcare affordable for everyone. So this is why Africa can never develop, because a president will come and destroy everything that the previous president have built in order for him to be seen that he is working. This is the exact thing that is happening in Kenya. The now president has destroyed everything that the previous president has built so that he can be seen that he is working. And Kenyans, they are tired. A lot of people, they cannot afford healthcare in Kenya. If you compare Kenya with Burkina Faso, Ibrahim Traore always said that healthcare is entitlement. It's not a privilege for the rich, but in Kenya, it seems like healthcare is a privilege for the rich. A lot of people, they are supporting this move. Some people, they have even volunteered to do free installation in these hospitals, while some people also, they volunteer to bring food for the patients, and also some people, they have volunteered to work for free in this hospital.
And here's where it gets really interesting. Posts are already hinting that government officials are in panic mode. Why? Because this grassroots hospital project directly exposes the failure of their own promises. Remember when President William Ruto declared that every Kenyan should be treated and go home without being asked to pay?
Kila mwananchi ambaye amejisajili kwa SHA, serikali tumeweka pesa ya kulipia gharama ya hospitali pale kwa dispensary, kwa health center, kwa level 4, outpatient is free for every citizen of the Republic of Kenya who is registered in SHA. Mutanisaidia kutembeza hiyo habari? mutanisaidia kufikisha hiyo habari mashinani? Yes. Na nimesema any facility ambayo italipisha mwananchi wa Kenya, mutupatie habari so that we can take action against those facilities.
Gen Z is holding him to his words and building the alternative he couldn't deliver. This is more than a hospital. It is a political statement, a message that young people are no longer satisfied with empty manifestos. If they can organize million-person protests, why not build hospitals? Of course, the hurdles are real. Acquiring land legally, getting approvals from the Kenya Medical Practitioners and Dentists Council, importing specialized equipment, recruiting qualified staff, and most importantly, keeping the hospital sustainable. But history shows this isn't impossible. In Uganda and India, communities have built and run hospitals through crowdfunding and donations. If the Kenyan diaspora and TikTok momentum keep growing, this could genuinely materialize. This movement isn't just about healthcare, it is about power. For decades, Kenyans have looked to politicians for solutions. Now, a digital generation is bypassing politics and building their own institutions. It's a radical shift in civic action. Imagine if this model spreads. Gen Z building schools, transport networks, even power grids. Suddenly, politics won't be about promises. It will be about catching up with the people. The TikTok hospital project is more than a trending story. It's a test of whether digital activism can cross over into brick and mortar nation building. And if it succeeds, it won't just change Kenya's healthcare system. It could redefine what it means to be a citizen in the 21st century.
Linda Mama was good. Linda Jamii is obviously better. And therefore, it is an improvement from what it was in terms of the scope, from just delivery of mothers, which was the primary target of Linda Mama. And it's no longer targeting Mama. It is targeting Jamii. Mama plus the children plus the household.
Nobody has scrapped Linda Mama. But what have we done? We have enhanced the cover of Linda, of the mother, and added the family.
So the question isn't whether Gen Z can do it. The question is whether Kenya's leadership is ready for the future they are building without them. What do you think? Drop your comments. Newsroom, Maisha TV, Ushabi Jr.